Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse urgently updates a doctor about a patient who is experiencing a severe asthma attack. Now read the question.
This is Emily Dawson. She's come in with a severe asthma attack. She has a history of chronic asthma, and this isn't the first time we've seen her in this condition. The last time she was here, we managed to stabilize her with a nebulizer treatment and oxygen therapy. But today, she's very anxious and struggling to breathe, which is making it difficult for the inhaler to be effective. Her anxiety seems to be exacerbating her symptoms, making the situation more critical. We may also need to monitor her oxygen levels closely, as her breathing is quite labored.
I see. So, would you suggest starting her on a nebulizer right away, or should we administer a bronchodilator first? We need to ensure we're addressing both her immediate symptoms and any underlying factors that could worsen her condition.
I believe we should start with the nebulizer immediately. The bronchodilator can be added if she doesn't respond well within the first few minutes. Given her current state, time is of the essence, so a quick intervention is crucial.
Now look at question 26. You hear a medical professional explaining a diagnostic procedure to a colleague. Now read the question.
Let's discuss the treatment plan for Mr. Jenkins in Ward 3.
Sure. I was thinking we might need to adjust his medication because of his age. He's not responding well to the current treatment.
That's one possibility. What do you think is happening with his respiratory symptoms?
Well, it could be pneumonia, but his cough doesn't seem severe enough.
True, pneumonia is possible, but let's consider something more common for his age. What other respiratory issues could be affecting him?
He does have a history of smoking, so maybe chronic bronchitis?
You're close. Chronic bronchitis is a consideration, but think about something simpler that could explain his shortness of breath.
Could it be something like COPD?
Yes, COPD could be a factor, but his symptoms seem less severe. What might he be experiencing that's less severe, but still impacts his breathing?
Maybe just a mild exacerbation?
Right, a mild COPD exacerbation.
Now look at question 27. You hear a nurse provides a detailed update on a patient's health. Now read the question.
We have Miss Gloria Hansen, a 65-year-old woman who underwent a left knee replacement yesterday afternoon. Her incision site is clean and dry with no signs of infection. Post-operative observations are stable. Her temperature is 36.8 degrees Celsius and her blood pressure is 130/85. She's had her first session of physiotherapy and she managed to walk a short distance with assistance. Pain management has been effective. She's been given paracetamol as prescribed, and it's controlled her pain well. Miss Hansen is scheduled for discharge tomorrow morning, but before she leaves, she'll need a follow-up appointment with the physiotherapist in 2 weeks. Could you please arrange that for her? Also, I've printed some recovery guidelines for her to read through before discharge, but I haven't had the chance to discuss them with her. Additionally, it might be beneficial to ensure she understands the importance of adhering to her physiotherapy routine at home to aid in her recovery.
Now look at question 28. You hear a doctors discuss the challenges in organizing a health seminar. Now read the question.
How's the preparation going for the upcoming health seminar on diabetes management?
Overall, it's progressing well. We've received a good number of registrations, so I'm pleased with how our outreach efforts have paid off. However, we're encountering some issues with securing high-quality educational materials. Given that these attendees are dedicating their time to improve their knowledge on managing diabetes, I want to ensure we provide them with the best resources possible. Do you have any recommendations on where to source top-notch materials?
Absolutely. That's a significant concern. I'll reach out to a few colleagues who might have contacts for specialized diabetes educational resources. We want to make sure everything is up to standard.
Thank you. I really appreciate your help with this. Your connections could make a big difference in the quality of the seminar, and I'm sure the participants will benefit greatly from the enhanced content.
Now look at question 29. You hear a discussion between a doctor and nurse on a medication. Now read the question.
Excuse me, Dr. Mitchell. I wanted to have a quick word about Mr. Thompson's blood pressure medication. The one you prescribed for him last month, lisinopril.
Yes, for his hypertension.
That's right. He's been on 10 milligrams daily for about 4 weeks now. However, he mentioned to me during his last visit that he's been feeling unusually lightheaded, especially when standing up. He also said he's had some persistent dry cough since starting the medication.
Those are known side effects of lisinopril. It does cause a cough in some patients, and the lightheadedness could be due to a drop in blood pressure. We might need to reassess his treatment plan.
I was thinking the same. I'll review some alternatives and bring them to your attention later today.
Sounds good. Thanks for bringing this to my attention.
Now look at question 30. You hear a doctor provides a patient with treatment plan. Now read the question.
Now, the good news is that we don't need to use steroids for this, so we won't be going down that route. Instead, I'll be recommending a daily application of a moisturizing cream. It's called Emollient X, and I'll write it down for you because it's usually more affordable to purchase over the counter. This cream is actually the first line of treatment for eczema at this stage. I hope you don't mind this bit of scribbling.
That's perfectly fine, thank you.
Right. So you'll apply this cream twice daily, ideally after showering while your skin is still slightly damp. Most people tolerate it very well, but about 1 in 100 may experience some mild irritation. If you notice any irritation, stop using it, and we'll need to explore other options. Let's give it a try and see how it goes, but I'm confident this will help manage your symptoms effectively.